autonomy, beneficence, veracity. There's one more in there. Justice. Those are those things that you should know. Now, I'm going to go a little all over the place. I apologize, not really. But it's what's in front of me. If you don't like it, then you can leave and not get a review. So, the first grouping of questions likely is around anorexia, bulimia, and you should generally know and be able to apply what drives the problematic behaviors in anorexia versus what really drives the problematic behaviors of bulimia. We talked a bit about the medical complications of anorexia. You should know those. Some laboratory stuff. I think broadly in general, so to me that can be applicable to almost any patient population. A lot of this will be about therapeutic communication, but then we should get into get past that. PTSD and what the major symptoms of PTSD are. I saw a question online. Someone's leaving. You should know about panic attacks and anxiety and what the priority interventions are for anxiety. When we talked about the concept of grieving, adaptive versus maladaptive grieving, more therapeutic communication. In bipolar disorder, We talked about food choices. Should go back to that. Is this somebody blue light?
Yes.
Hello?
You look great today. Such a fun
Seems suspicious. Okay. In terms of medications, I'm going to focus on, there are SSRIs, lithium, and antipsychotics, some of which we'll talk about a bit. But if you know the teaching points, like a question that I think is actually a complicated question, I like complicated questions, are going to be, for example, teaching about certain medication. And the 4 items are going to sound great, but they're going to be for the wrong drugs. So for example, if we were to talk about Prozac, and if we were to say that a patient should be taught to watch their sodium levels, would that be appropriate for Prozac? No. What's that appropriate for? Lithium. That's the type of question you're going to have to sort of handle. It'll be a medication question, apparently. Again, it'll be about lithium, 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 lithium.
3 questions on lithium?
A bunch of questions. You should know about legal statuses in terms of hospitalization. So we talked about the reasons why someone may be voluntarily versus involuntarily admitted to the hospital. You have a list of patients who would be involuntarily hospitalized. Why would they be involuntarily hospitalized? There's a question in here about therapeutic relationships, which was on one of your exams that I got wrong. I'll help you with an answer. What's the best way to start a therapeutic rapport with somebody? Be nice to them. All right, get more questions about medical complications of anorexia, complicated versus uncomplicated grief, ethical principles. Then we got some bow tie questions. Go back, can't see those. Love bow tie questions. There's a bunch of math questions. I'll tell you how many. There should be 4. Okay. Math questions. What's the priority in almost every nursing care issue you can ever have? Safety of self and others, absolutely. Terms in terms of bipolar disorder, like what the difference is between paranoia, versus religiosity versus grandiosity. There's also going to be some terms that are more significant to psychosis, like flight of ideas and associations, playing associations. All those terms are important. Adaptive versus maladaptive coping mechanisms. Again, you won't have to name them, but you should know which one is adaptive. Just like interventions for bipolar disorder, interventions for depression. In ethical principles, you should know about informed consent. There's phases of the nursing relationship. Talked about orientation phase, working phase, termination phase, those guys. So you should know the reasons for self-destructive behavior. And positive and negative symptoms of schizophrenia, which won't be on your exam, which is why I want to stress it out. Any questions? I'm happy to answer any questions you have about what I just described. That should get you most of the way there in terms of without what's on your exam today. Without what's on your exam today to what's going to be on your file. Any questions I can answer about those topics? Or details you want to know about? Chance to ask questions.
Yeah, I got that.
Clarifications. Curiosities. Uncertainties.
With the antipsychotic, you said there is no therapeutic level, right?
Correct.
So basically, we know it's working because the person no longer has this, is exhibiting symptoms. I just want to confirm.
Yeah, so if someone is, if they're having hallucinations, you know that the medication is effective when the hallucinations start to go down.
Okay.
Just like if someone's depressed, they feel less depressed. That's how you know it works.
Okay.
Question for the term paranoia, grandiosity, psychosis. Was there another one?
I think in that, you should know the working terms. So things like paranoia, grandiosity, hyper-religiosity. Those are sort of types of delusions.
Hyper what?
hyper-religiosity.
Oh, religiosity, okay, I heard the religion.
So then there's other terms you should know, like positive symptoms, negative symptoms, flight of ideas, affect, mood, all those terms that we've talked about that you may not remember off the top of your head. Those are all ones that may help you to answer questions along the way.
No.
Sorry.
No, don't ever say sorry.
All right, so let me just look at the multiples and see if there's any other advice I can offer. All right, so more eating disorders.
Yeah.
You'll notice this will be somewhat heavy in eating disorders.
What happened when we missed that?
All right, let's talk about Are we okay if we go over break?
Yeah.
Yeah.
All right, so what we'll do is I'll go through this, then we'll take a break, and then you guys can study for the rest of the time until there's an exam room free. Okay, let's go to today's stuff that you probably should know about. Let me just go there. Okay, so things that you should generally know about for the final and maybe for today are the characteristics of personality disorders. So for example, what are the basic characteristics of each personality? So for example, what would someone with a antisocial personality look like, or borderline look like? And at a more broad scale, what is a personality disorder, and what's the goal of treating someone with personality disorder? So for example, we're not just going to change their personality. It's about getting them to develop those skills and healthy habits to be able to function in life. You know about splitting behaviors. Let me just see if there's anything else here. That's anything there. This exam will be a little bit, not heavy, but you will see a bit more questions on here than on your final. There may only be one or two questions on the final about conversion disorders and fictitious disorders, so you should know what a fictitious disorder is, what a fictitious disorder in another person is, or a fictitious disorder in hypocrisy, and what a conversion disorder is. And if someone comes in with complaints of somatic issues, what do you do before going to psych? AKA,
Don't you have to rule out any of the other?
absolutely rule out medical issues beforehand. Label indifferences.
The what difference?
Label indifference. If you don't know what the label indifference is, you're going to get a question. Hint, hint. And then I think most of the other questions are going to be about suicide and about substance use. Excuse me. So if someone discloses suicide, what's the major nursing intervention never to forget? What? Don't leave them alone. One-to-one observation. You should know the differences between risk factors and protective factors. There's going to be one of those questions where there's two columns, risk and protective, and you're going to have to choose protective. You should know about the key questions to ask someone if they are disclosing suicidal thoughts. Like, do they have a plan? What do you ask them? If you have a patient in med-surg who has a ton of belongings, and they start to say they're suicidal, what else should you do besides not leave them alone? Check their belongings. What's the first step that someone has to do when they're going through treatment with substance use disorder? Admit they have a problem. So if someone has an opioid toxicity, what vital sign is going to be most significant for that? Respiratory rate. Which way is the respiratory rate going to go? Okay, now let's do critical thinking. If you have someone that's suspected of opioid toxicity or intoxication, and you give them Narcan, what vital sign should then improve? Respiratory rate. What's the most significant impacted organ in alcohol abuse? There's going to be fine. For treatment of overdosing on okay. You should know the difference between withdrawal, dependence, tolerance, those type of things. When do alcohol withdrawal symptoms typically start? Within 24 most definitely. But yes, if you're, and this is where it's weird, the more you drink, the longer it takes for the symptoms to set in. So if you just have a beer or two, you're going to have 6 hours. That's why you wake up in the middle of the night like feeling weird, so withdrawing. But if you abuse substances for a long time, it can take up to a day. And then the last set of questions is going to be about, I'm hopeful I'm hitting them all, or you're going to find a question like, yeah, tell us this, I'm going to tell them, well, too bad. So that's a disclaimer that this list is not. And then it's going to really get into schizophrenia. And the questions that I'm going to describe are both germane to this exam, but also to your final in multiple other ways. So for example, hallucinations and delusions. No matter if someone has bipolar disorder or they have schizophrenia or whatever else, the management is generally the same. So for example, if someone describes their hearing voice, we typically say that the best intervention is to say, you know what, well, I don't hear them. However, that's considered confrontational. So often we say the best response is first to say, you know, I understand you hear them. They're saying first. So if someone just says, I'm hearing voices, the first intervention before anything is to ask what the voices are saying. And if the voices are saying, kill yourself, what is that called? Hallucination. So remember that you have to sometimes collect more information before you can act. Sometimes you'll have enough information to act, but sometimes you need to do it. So if you say, you know, I hear voices, they're telling me to do bad things. Well, what are those voices telling you to do? So again, just saying, if a patient says, I'm hearing these loud voices, no voices. Too intense. I forgot to mention on a quick aside, you should know for abusive relationships, intimate partner violence, reasons why people stay in a relationship. There will be a few questions about antipsychotics. For example, I told you last week, I'm not telling you the answer, that clozapine is going to be on your exam today, and there's a specific side effect for clozapine that you should know. And you should know about side effects of our antipsychotics, mostly dystonic reactions and tardive dyskinesia. I think that's really it. I think that's it.